Culinary Union, of course, the most powerful union there in Nevada, putting out a flyer that seemed to sort of attack your Medicare for All position, talking about how union members have fought very hard for their health care and it shouldn't be taken away from them. And then Pete Buttigieg kind of piggybacking on that attack, saying this is why labor unions are skeptical or even opposed to your Medicare for All position. What's your response to that?
My response is that I have a lot more union support than Pete Buttigieg has or I think ever will have, and that many, many unions throughout this country, including some in Unite Here, and the Culinary Union is part of Unite Here, absolutely understand that we've got to move to Medicare for All. And the reason is, if you talk to union negotiators, they will tell you they spend half of their time arguing against cutbacks for the health care that they have. They're losing wage increases because the cost of health care is soaring. When everybody in America has comprehensive health care, and when we join the rest of the industrialized world by guaranteeing health care to all people, unions can then negotiate for higher wages, better working conditions, better pensions. So I think the future for unions is through Medicare for All.
So what you just heard there was Bernie Sanders last night on MSNBC talking to Chris Hayes about Medicare for All and how some key sources like Pete Buttigieg and the Nevada Culinary Union are lying about what Medicare for All means. They're saying that it means the destruction of union healthcare plans. It means that workers will lose all that they bargained and struck for, and that only a public option model is good for unionized workers because Bernie Sanders and the single-payer model will, by government decree, steal their hard-earned plans. But that's a lie, not only about what Medicare for All does, but also about what's good for working class people in unions and outside of unions. And this is all based on what I feel is a very coordinated effort by the Culinary Union and the neoliberal Democrats. Because the Culinary Union put out a flyer which basically said that Bernie Sanders wants to end the Culinary Union healthcare plan. But that's not true. Bernie Sanders' vision of Medicare for All not only includes transitions, but actually includes integrations specifically for union healthcare plans so that they can be part of the Medicare for All system while still preserving the history and the culture and what they fought for through their negotiated plans. So to say that Medicare for All ends their plan is a gross oversimplification at best and an outright lie at worst. And unsurprisingly, Bernie Sanders supporters responded. And then the Culinary Union, without any actual evidence really, said that Bernie Sanders and his supporters were targeting them, were being mean to them on social media, and this is unacceptable and blah, 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 blah. And then you had Pete Buttigieg and Amy Klobuchar and Joe Biden and even Elizabeth Warren all come to the defense of the Culinary Union, saying Bernie and his people are being mean. And this was all done on purpose. Lie about Bernie, let people respond to the lie, and then say the people responding to the lie are the meanies here, are the baddies here, are the uncivil, divisive people here. It's all coordinated BS from a right-leaning union leadership and right-leaning Democrats who don't give a damn about working people. And some of the leaders of this union are actually rooted in neoliberal organizations like the Center for American Progress, which is headed up by anti-Bernie Democrat Neera Tanden. This is all rotten. This is 100% rotten. The Culinary Union damn well knows that Medicare for All is the best way forward for working people, but that union's leadership is so rooted in with the neoliberal wing of the Democratic Party that they will fight the interest of their members and of working people if it means stopping Bernie Sanders. Because here's the deal. I 100% get that unions have fought very hard for their healthcare plans. I was a union member for many years. My wife is a union member. We understand the struggles that unions go through every day to fight, to expand, and to defend what they've won for their members and for wider society. Bernie Sanders gets that more than any other person running in the Democratic primary as the most staunch ally and champion and defender of workers and of unions. But here's the deal. Just because unions fought hard for these plans does not mean that a single payer vision isn't superior to a patchwork model, especially when Bernie Sanders' vision for a single payer includes the incorporation of union models within it. It's not an either or. Union negotiated plans are good. I'd rather be in a union than not a union in the United States. And a big reason is because my union has likely negotiated a decent health and dental plan and pharmaceutical plan for me. But to say that it's all good and fine is wrong. If I lose that job, I lose my plan. I don't get to keep that plan. I fought for that plan. I was part of the team that helped negotiate that plan. I was part of the people that went on strike potentially for that plan. But as an individual, as soon as I lose that job, I lose that plan. It's not mine anymore. So I don't get to keep it. I was part of the struggle to build and expand and defend it, but I don't get to keep it. That doesn't seem very fair to me, and it doesn't seem like it's actually looking out for the rank and file members, who are one misfortune away from being without the insurance that they negotiated for and that they sacrificed for. It should also be noted that when you go on strike, your healthcare can be taken. GM workers that went on strike, who have a union negotiated plan, started having their healthcare attacked by the employer as a negotiation tactic, as a strike breaking tactic, because they knew that these workers wouldn't want to go without their insurance, and they are beholden to their employer. And even if you're in a non-union environment or a union environment, your healthcare plan can trap you. It can trap you from moving to other jobs. It can trap you from speaking out against injustices. It can trap you against trying to build a better workplace because you're always worried about not only getting fired, but losing the healthcare insurance you need, which keeps you one misfortune away from absolute devastation of yourself and your children, your spouse, your family. Unions spend so much time negotiating healthcare plans, and most unions recognize that this is a waste of their time. That if they could focus on pensions and wages and quality of work and workplace safety and hours of work and so many other things, they would be able to win more for their members. And if a single payer model took care of healthcare, they would have that much more time to fight for their members on all the other issues. And Bernie Sanders' Medicare for All vision ensures that if there's any savings for the employer as a result of moving to a single payer model, that money be reinvested in the collective agreement to improve the standards of work for the working people. So it's win-win for rank and file workers in Bernie Sanders' Medicare for All vision. And I want to bring in my Canadian experience here, because I've done this before when we've talked about healthcare, when we've talked about single payer. And here in Canada, we have a hybrid model. A lot of Americans like to venerate our model because they think it's superior, and it is better than what you guys have. I won't lie. But there's a lot of things in Canada that aren't covered. And one of the big ones is medication. So again, you go to the doctor and you get a prescription, that's free. But then to fill the prescription, you better hope you have the money or a workplace health insurance plan to cover that medication. And you better hope that there's not a high deductible and things like that. Same thing that working class people in the United States face, union and non-union. But here in Canada, many unions have negotiated supplemental health plans to cover things that aren't covered by the single payer system, like dental, like medicine. But unions don't want to do that. Unions have to do that because their members need it. But unions do not want to spend time negotiating that stuff. And the Canadian Labour Congress, our version basically of the AFL-CIO, the biggest umbrella of unions in this country, for years now has made one issue above all their national priority. They have lots of priorities to help workers, but universal single-payer pharmacare has been the main goal of the Canadian Labour Congress in terms of how they lobby the government for years now, because they realize that while lots of unions have worked very hard to negotiate plans that cover the medicine of their members. And in some ways, that's the only way people can get medicine, because without it, they couldn't afford their medicine because it's not covered by the government. They do not want to do that. And they would rather replace their negotiated models with an actual single payer, centralized government plan that covers everyone, which would free them up to negotiate for better things that weren't human necessities. You should not have to negotiate for your medicine, for your teeth, for your basic goddamn health. That should be non-negotiable because it's a human goddamn right. You negotiate for better wages. You negotiate for vacation days. You negotiate for a 4-day week. You negotiate for a shorter day. You negotiate for better lunch hours. You negotiate for those sorts of things. Unions should not have to negotiate over the health and well-being of their members as human beings. Bernie Sanders and his Medicare for All vision is the only real path forward for the American working class, union and non-union. And unions that oppose Bernie Sanders here are not doing it to defend their memberships. They're doing it to defend their privileged connections to the Democratic Party's corporate elite and nothing more. And this is all beyond the fact, guys, and I've noted this on the channel, that Bernie is the champion of unions on other issues. He wants to give workers more control of their workplace. He wants to empower unions to have real say in how their companies are run. He wants to empower unions to make it easier to sign up members. Bernie Sanders wants to double union membership in the country. Bernie Sanders wants to end the broken system of right to work. Bernie Sanders wants to create a $15 minimum wage. Bernie Sanders wants to do all sorts of things that help the broad American working class. And the first and biggest of those is a Medicare for All model that will guarantee as a human right, even if you don't have a job, even if you're in a union or not a union, your health care. There is no alternative to that.